This is Agnes, the presenter of Sickle Cell Talks with Agnes. Welcome to my YouTube channel. So stay tuned because every week we'll be posting videos about any topic in sickle cell disease. We don't have set days yet, but just turn on the post notifications for you to be notified every time we post a video. Thank you and stay tuned. If you've got any questions, get in touch with me on social media or social media platforms. Thank you. I'll quickly dive into Biba Tinga joining us from Canada. She's the president of the Canadian Sickle Cell Association. Biba, take it, please, if you are there. Thank you.
Yes, I'm here. Hello, good morning, everybody. So I said I was going to start by thanking ASCA and the president, Agnes, my dear friend Agnes, for this kind invitation and for the opportunity to bring greetings from warm Canada. I'm really happy to be here and especially to have the opportunity to share our experience as, how we deal with sickle cell and how we are living here in Canada. And I proudly represent today the 6,000 individuals who live with sickle cell disease here. And through our organization, which is the Sickle Cell Disease Association of Canada, our organization was founded in 2012, and it's a national umbrella for provincial groups who are working on the ground, to support patients and families living and dealing with this very debilitating disease. I'm going to start by telling you what we've done so far in Canada regarding sickle cell as patient, family, and support groups. We as an organization have established this organization to support, our main mission is to improve the quality of life of people living with this condition. So what we've done so far, we have 6 groups who are members of this national organization. So I think only 1 province to go. We've been able to get a newborn screening, in 7 provinces and 3 territories. So just 2 more provinces to go, and Canada is going to be covered with that. We've created and implementing a national research program, and that we're trying to attract researchers, to come into the sickle cell field. And most importantly, again, we've put Canada on the map as the first country to pass a bill to recognize June 19 as Sickle Cell Awareness Day, following the recommendation by the United Nations and the World Health Organization. As you may know now, for us in Canada, June 19, we have a bill that passed, it's a law here. So we have Sickle Cell Awareness Day in Canada. And I invite you to do so in Australia, because I think this is how we can change things for patients and families, because we need to do, I see that today this organization in Australia has the support of the policymakers. It's very important. It's a partnership to work with the healthcare providers, the policymakers, and everybody, all the partners. So I think, Agnes, I know that you have that in plans with ASCA, so I'll be happy to share any information and then support the process. Now, so I've been the president of ACDC since 2007. Prior to that, I was the vice president for 3 years. Of course, I've not done this work alone. We have a dedicated teams of volunteers, of patients who are also now coming and, supporting all our work, and also the parents themselves. So how did I get here? Again, it's because I'm a parent myself. I'm a caregiver. My first child was diagnosed when he was 7 months, and in West Africa, Sub-Saharan Africa. I'm from Niger originally. So that's when, without knowing, when the diagnosis happened, your first reaction is just to sit and cry, and my whole life was shattered. But after a few days, you understand that if you do not educate yourself, if you don't take control of the situation, then you know what? The person living with the disease is going to suffer or might even lose their life. So I started just trying to understand the condition, just asking questions, just reading anything I can find, because at that time it was more than 30 years ago. There was no internet, to go to and Google search. Even though, so I had to find books that were sometimes totally medical, information that I couldn't understand all of it, but I could at least see, okay, this is what I need to do. And I understand pretty early that I need to listen to the physician. I need to show up, for all medical appointments, and I need to take good care of that child. Well, what I what I didn't know at that time is that sickle cell could, like, what for me at that time it was a death sentence, but now sickle cell is not a death sentence anymore. So you can imagine, you know, raising a child in this environment where you also face other limitation like stigmatization, the fact that maybe some people don't talk about it, so you can't have a support group. You know, some people going through it, even when we used to meet with other mothers at the hospital, they would not really open up and talk. So you were really on your own. And I remember for the first time when a nurse told me that the hospital might not have blood for him if he needed it, you know, in a case, in a sudden crisis, then I started looking around, calling people to come and donate blood. And without knowing, maybe I think that was the first time I started advocating, you know, and really doing more than just being a parent and bringing my child to his normal doctor's appointment. So fast forward around the age 15, when my son was around age 15, we moved to Canada. And that's when everything changed, you know, because he was able to have, you know, access to good care, better care, I must say. When we got here, he had a growth delay, 3 years, and he was really frequently at the hospital, you know, and he was missing school. So with that, again, you know, that was impacting, you know, his emotional and mental well-being, you know, always feeling like you can do better, or you would love to be like everybody, but you can't. So he was able to have, you know, a break here, you know, just the fact that, you know, the pain was well managed, and he went on to the blood transfusion program, and then he started growing up, and I saw a different person emerge, somebody that now we can talk and talk about future plans. And myself as a parent, you know, I realized that, okay, I need to just raise this child well. What I mean by that is that, not that I wasn't raising him before, but you raise a child that you think has a condition that will limit, you know, his life expectancy. So the way you deal with that child is different. There is guilt. There is also the fear of losing the child. So you might not really treat him maybe like you will treat another sibling that who is healthy. So that also impacts the family life, because I have 3 other children who are healthy, do not have sickle cell. And even though one of them is a carrier, and sometimes, you know, this is the reality of sickle cell in a family. It's going to impact the siblings. And if as a parent, you are not careful and you don't pay attention, you might also miss something there. So just Canada was good for my son. He's today he's a young adult. He's independent, living on his own. He has a career. He's a pharmacy lab technician. And all that is thanks to better treatment option, because he was able to go to school, to college, and graduate. And I was able to have more time and advocate and be where we are today. And I must say, but with sickle cell, we have to stay connected. We have to stay informed. We have to educate our community, because what people don't understand is that even with all these new treatment options that are available now, you know, we are happy. We are in a new era for sickle cell, but we still have to continue to fight, because even when you have the care, it's not a guarantee that, you know, you will have access. Even if it's available, you have to fight for it. And once you get it, sometimes, you know, it's about policies. It's about maybe sometimes also that, you know, sickle cell manifests itself differently, you know, and one treatment works for one person and it might not work for the other person. So we have to continue to push for more research to make sure that, you know, there are more treatment options so that everybody can find what works for them. So also, we have to break the stigma around sickle cell in our own communities first, you know, the way we view it, you know, the way that talking about it, it's very important. Just have a support group, sharing, you know, the emotional burden, and also going into maybe therapy, because also, as for myself, I can speak from my own experience, you know, when my child was growing up, you know, we didn't talk about, you know, talking about the condition. It's, you know, the emotional aspect of it. We will just deal with it, you know, physically. So go to the doctor, take the medication, the treatment. But then when the person is sad, when the person is not feeling well, when the person is down, we'll just, you know, pray sometimes, and then which sometimes, you know, it helps. But I'm a big advocate, of, taking care of your mental health, So, and that is important, being able to have relationship, to make connection, to find love despite everything, and to keep a career. So that's why we do what we do, as advocates, as parents, we support them. And I'm really, really, really happy to see that now even the patient themselves are becoming, patient advocates, they have to advocate for themselves every day when they go to the hospital, or they have to be there, to take care of their own. But at the same time, they also now stand with us. Today we're going to have a virtual event in Canada. If you're not sleeping in Australia, you might join us. It's 5 to 7 p.m. And we have a panel of caregivers of patients who are going to share their experience, coping strategies, just to tell us, this is how we are doing it as a family, or this is how I'm making it as an individual. This is how I'm keeping my relationship, my career. And it's very important that, we talk about it. And I think doing this kind of international panel is very important, because we can learn from each other. We can share also, information and strategies. So I thank you all today for listening. Thank you.